Welcome, everyone. Welcome to Mother Nature's Treasure Chest with Nada and Sandy. And we're going to introduce to you Dr. Arturo Herrera. He is developed a beautiful product that is detoxing people. Nada and I have been taking it since December, and we're going to learn more about it and take your questions. So, welcome, Dr. Herrera. Can you hear us, Doctor? Oh, he's coming in. Okay, well, he's coming in.
Oh, okay.
So he's coming in on a different connection. And we're still waiting for his book. We're waiting for the book.
Oh, yay.
Yeah, they sent it. They sent it, I don't know, a month ago. I don't know. I better call them and find out where it is again.
Here it
And we
is.
yeah.
Thank you, Nada. I just saw what you sent. Thank you.
I couldn't type everything that you said, explaining your position, what you do.
Yes.
And that you are involved internationally in helping people. You are in the gut business and cleaning the gut and all the digestion and the digestive system.
Yes.
You collaborate with Donna Gates. You're part of her team, and you have you have a whole international crew basically that you collaborate with.
Yes.
So your particular interest is macular degeneration and the detox connection to the gut health as well in that regard, because everything is connected. We're not disconnected from anything, right?
Yes.
Is that correct?
Nada is discussing a question from one of our attendees. And so maybe Dr. Arturo, can you hear us yet?
Yes. No,
wonderful, wonderful. And so can you tell us a little bit about yourself, where you are and what you do? You're an ophthalmologist?
Yes, I am Neuro Ophamologist, and I'm live in Aguascalientes, Mexico. And in 1990, I began a study about the treatment cause of blindness and the blood vessels of the optic nerve. It was 12 years and 6,000 patients.
Oh, wait, what happened?
Oh, we lost you. You have to open up your mic, Dr. Arturo. It's yeah.
Okay.
Something happened, so I apologize.
Okay, and after 12 years and 6,000 patients, I found that the human body can dissociate the water molecule like plants. This is finding that changed the biology completely, because it was thinking that that the only living things that can transform sunlight into chemical energy, it was the plants. But no, the human body can take energy directly from light, from sunlight. And this is a very, very important process, because this changed biology, this changed medicine, this changed many things. The dissociation of the water, it's so accurate process, astonishingly accurate. It has not changed, it cannot change, it will not change. It's the same process since the beginning of time. But this accuracy is perturbed with contaminated water, polluted air, pesticides, herbicides, fertilizers, plastics, metals, alcohol, I mean, stress. And when the body is in this way, then begin to disorganize and disease appear. That's it. So, for instance, the name of disease doesn't matter because the body don't take care of that. If we restore the process, the accuracy of the process, then the body recover its capacity to recompose, to heal, to function well. This change medicine incredible because and we do not need thousands of medicines. No, just we need to restore the balance. And the
Now,
body.
are we born without this process, or are we genetically? Are we born with this capability, or is this something in our dormant in our DNA?
No, 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 no. This process is the beginning of life, like in plants. Our life begins with the water dissociation. And so everything comes from this process. Everything, no exceptions. For instance, genes requires this process. If the process is in this way, there will be some genetic problem. Down syndrome, for instance, is this one. Any disease, if not all the disease, almost all disease is begin with this imbalance because the body is almost perfect. Nature make it million years, million times. It's all the bodies are well done. All the bodies.
So, are we born with this then?
We need this to born, to be created, to be generated. If this process does not occur, not life at all.
Okay.
It's the essence of life, basically.
So I'm just trying to ask questions for people to understand this. So, what did you mention the eye? What part does the eye play in this?
No, it's because no, it's not a special function of the eye.
Okay.
No. It's just that in the eye, I found it, but it was because melanin is very difficult to study.
Mm-hmm.
It's very, very difficult. That's why nobody see this before me. Nobody. But I found this studying the boundaries of the optic nerve. But the optic nerve in humans is so small, 12 human hairs together.
Ooh.
It's small. And in this small place, I understood that our body can dissociate the water molecule. That is the beginning on any kind of life. Any form of life begins with this process. No water, no life.
So water is very important, and clean water is very important.
Yes, now we understand that must be clean water.
Yeah. Okay. And many times in this world, the water has been damaged.
All the water. Yes, for instance, the COVID pandemic is not an generalized infection. No, it's a generalized intoxication.
Yes.
Because dissolved oxygen levels in water is too low. It's too low. So the body cannot function with this kind of water. And we can see the proof. The countries that has less damage for COVID has better levels of dissolved oxygen in drinking water in all the world. And the country's worst damage is the worst level. For instance, Brazil, Ecuador, United States, Mexico, the levels of dissolved oxygen is around 2 milligrams per liter. Minimum must be 6 milligrams per liter.
Minimum of what? Daily
Oxygen.
intake?
Dissolved
Oxygen.
oxygen levels.
Oxygen level.
So basically, we need to ozonate our water.
Sorry?
We need to ozonate our water,
Well, oxygenate.
oxygenate
Yes.
our water.
No, yes. But it must be oxygenated like nature make it.
Yes, of course.
No, add oxygen, for instance, oxygen peroxide. No. Oxygen, molecular oxygen.
Molecular oxygen.
Yes, must be. Yes. We need a minimum level of 6 milligrams per liter of oxygen levels, and everything works well. No problem.
Mhm.
And so what key does the melanin product play in that role?
Qiapi.
Okay, Qiapi restores the balance in the human body.
Mhm.
That's the function.
So it puts it back together, so it gives you a chance, and then you move on from there. Drink the right water, and you'll be fine.
Yes. If dissolved oxygen levels, it's in good level, even Qiapi is not required.
I see.
But
So it's the missing link to us restoring the oxygen level in our water in the body.
in all the body, yes, all the body, because it's an astonishingly accurate process. Astonishing. If you take a lot of Qiapi, the level of photosynthesis does not increase. No, it's astonishingly accurate. It's strictly regulated, as has been million years. So you can increase the photosynthesis 110%. No, it's not possible. At most 70%, 80% at most, and using the drops every hour on every half an hour, because even the effect of Qiapi is regulated for the body.
Mhm.
That's why with Qiapi we don't have problems, no? And once the body goes into balance, then begins to work well, to restore well, to function well, but all the tissues, cartilage, bone, muscles, eyes, mind, everything, there is not exception for the balance. All the tissues depends of completely from this accuracy.
Okay.
Interesting, yes?
Yes, it is. Fascinating. Fascinating.
Yes, and it's, now the medicine is simple.
It is simple.
Yeah.
So we take the Qiapi 7 times a day. Is that correct?
Yes, if you feel well with this dose, okay. But when you have a season for heat, cold, sound, everything, because our body is like the surface of the sea that constantly is with night and day, cold, hot, rain, winds, etc. Our body is the same, works in the same way because we are 70% water. So we are working very similar. So when we feel some upset, some symptoms, pain, sadness, anything. The name of the symptom is doesn't matter. If we feel bad, it's because we are in imbalance in that moment.
Right.
Something happened. Pollution increased. We don't eat adequately. We don't drink water. Many things. But it's enough that increase the frequency. For instance, every hour or every half an hour.
Mhm.
And when we feel the well-being of the balance, okay, we return to every 2 hours, but it's very positive that take care of our body when make this imbalance, because our nature, everything has this uh,
Vibration.
okay, and but when we are not in well-being, in well shape, is heavy. But with Qiapi, return to health.
Mhm. Rebalance. Our body rebalances.
Healthy. The
Healthy.
body rebalance.
Yes.
And so you've had a lot of people coming to you that aren't coming to you for eye issues. Isn't that correct?
Sorry. Again, please.
You have people that visit you for other conditions other than the eyes.
Yes, yes, because at the beginning, my first success was in the eye. Glaucoma, macular degeneration, diabetic retinopathy. I begin to see that any disease respond and respond very well. Inflammations, uveitis, dry syndrome, every disease improves and improves very well. But gradually, I found that the process is the same in all the body. For instance, in the knees, in the hips, in the back, in the backbone, in the mind, because macular degeneration is considered the Alzheimer of the eye.
Mm.
The
It's the
what of the
same,
eye?
Alzheimer of the eye.
Ah,
yes, the same age, the same histological pictures, the same risk factors, and even there are researchers that say the same treatment that improves macular degenerations will improve Alzheimer's disease. And it was true. I began to treat Alzheimer's disease, and the results were very well. I have Alzheimer patients that eventually return to work.
Wow.
that's
Yes,
wonderful.
it's a new era, and
New era.
and the balance not only improves, also prevents.
And how long does it take for someone with these conditions, do you think, of taking the Qiapi? Is it
All the life. All the
overnight?
life, because
No, all your life. All your life. You
No,
don't stop.
sorry,
how long does it take in most situations for this condition to correct, that they can return
it's
to good function?
It's variable because depends of the pollution of the environment
Yes.
where the people live. So
Right.
in more polluted circumstance, it's a little bit more time. When the environment is less polluted, it's more faster. But we see many kind of patients. Usually in 15 days, patients or familiar or relatives notice that something is happening. And
It's
in
true.
spite
That
that
is
this,
true.
sorry,
It's true.
yeah, yes, it's because the patients begin to talk, to walk, to eat differently. Even the expression is different, and the improvements is increasing every day a little bit, because with each application, your body repairs itself a little bit, a little bit, a little bit, a little bit. So if it's like the way we know that our body begin to be better from the joints, from the hands, from the heart, from the lungs, from the kidney, everything.
And because it brings balance to the cells, then the cells correct the imbalance in the body.
Yes, yes. The balance begins inside each cell, because the Qiapi restores the balance in every cell, in every single cell, at the same time. It's
And
wonderful.
And the substance is melanin that is created?
Melanin precursors, because melanin is a so big molecule, so big, it's the biggest in the universe. So
Really?
our body cannot absorb a molecule of that size. So we take a knife and cut melanin in small pieces, and in small pieces, and then our body absorbs.
See. Thank you.
Basically, it's a nano component of melanin. Nano component, right?
Not too much nano, but see, small, because nano is the smallest.
It's the smallest. Okay. Okay. Small enough for the body, for the cells to absorb and then repair, self-repair.
Yeah, that's why the treatment function in any disease, because we just put the body in balance. Is all the effect. Balance with mass and energy.
Yeah.
And a body with this balance is very efficiently to restore itself, to health itself, to maintain itself, to function itself. And the body attends all the body at the same time. It has the capacity.
Have you
Can
been,
I ask? Go
have
ahead.
you been working with anyone that has been had the vaccine with your product?
Well, Qiapi protect from the secondary effects from vaccine. But with Qiapi, you don't need
The vaccine.
vaccine, because a body imbalance will not have COVID. No problem.
Thank you.
So there are a lot of people that have opted to take the vaccine. And a lot of people are having, negative effects,
Of course.
or as they call, there's a lot of shedding, which is affecting other people around them, healthy people.
That was my question.
So Qiapi's function in such a condition would be, again, probably balancing and protecting the healthy body that is taking Qiapi, right? That is in harmony from any of these effects of the shedding, or
I could say yes.
good.
Yeah,
I
because,
agree.
because it's the body that will makes the works,
Yeah.
and the works has a lot of million years of experience, and the works and the body works very well. Just need to be in balance. It's the main requirement. It's fundamental.
Yeah.
So if the people make damage to their own body with vaccines,
Yeah.
okay, the balance restores in a good measure the health,
Mhm.
because something is very well damaged, so the result of the Qiapi will not completely, but always be an advantage.
Mhm.
And frequently it's dramatic, the effect of the balance.
Mhm.
Thank you, Dr. Arturo.
Yes.
So should we take questions now that we've gotten a good introduction of what the product is and how it works? Does anyone have questions? You can put them in the chat, or you could raise
Pam,
your hand.
You had something to say, Pam. Yes.
Yes, Dr. Arturo. The melanin, does it have anything to do with vitamin A and the retinol palmitate and the coenzyme part of vitamin A in that coenzyme process of the different vitamins getting in there and getting in the system where fats and different types of foods can be digested? It's a pathway genomically. And I'm wondering if the melanin has anything to do with vitamin A, because some people genetically cannot take vitamin A. They don't absorb it. They have to have retinol palmitate, or, that form of vitamin A. And I didn't know if that had anything to do with the melanin that you've developed as far as vitamin A for the eyes, regarding the eyes.
Well, it's because the genetic function depends of balance.
Mm-hmm.
Enzymes depends of balance.
Mm-hmm.
The compounds that is transformed when it's ingested and travel to the blood tissues has a series of transformations, chemical transformation.
Mm.
And every single step depends of balance. So if balance is okay, all the steps will be okay. For instance, intolerance or something like that disappear.
Mm. Wonderful.
Yes, it's magic because, but it's to be expected because it's the body that makes the hard work, the fine work. We can expect this and more.
Mm-hmm.
I see my main apportation was to recognize the button that I have to push, so the body, boom.
Mm-hmm. Mm-hmm. Thank you.
You're welcome.
Thank you for your question, Pam.
Yes. Excellent. Thank you. Any other questions?
I have one more.
Go for it.
Okay, Dr. Arturo, you had said that the water needs to be molecularly oxygenated. Is that something we can do to our water? Is it a particular instrument? You know, because we ozonate water now for, you know, to be injected into gums or to take by IV that addresses a lot of, you know, infections in the body and that kind of thing. So how would we get the molecular oxygenated water, or how do we make that happen?
It's very, very, very difficult.
Ah, okay.
It's look at I am in the treatment water treatment plants not increase molecular oxygen, dissolve it. No, the chemical addition don't increase molecular dissolved molecular oxygen. So it's a formidable challenge. We develop a process 8 years ago based in the way the eye maintains water inside the eye. Because in every eye, we have around 3 or 4 milliliters of water. And this water is stinky. It's never replaced during all the life. So it's very interesting because all the life, the levels of dissolved oxygen is higher. It's very interesting. And we could identify the biochemical process. And then we replicate in the laboratory. And we tested in several samples of water, drinking water, seawater, water, in many kinds of water, and the process function. But we developed the process to apply industrially. But with the pandemic, it has a very high importance because with this material, we can increase dissolved oxygen level, like in the eye. These blocks, because it's a block, it's just submerged in the water tank of the house, for instance. And in the block goes to the bottom. And that's it. The blocks begin to increase dissolved oxygen levels like in the eye. And it works night and day, like in the eye, and it works during 25 years, 30 years, like in the eye. So it's the only solution, only practical solution, because it's just to submerge the block in the tank, in the water tank, and that's it. No energy, no chemicals, no secondary products, no products, no CO2. It's wonderful, like in the eye. So it's I think it's the best option because the other options are so expensive, and it's very difficult. For instance, some people propose to inject oxygen inside the water, but it's so expensive. It's so expensive because oxygen is not cheap. It's expensive, and the pump that that push the oxygen inside water must work night and day, 24 hours a week, 35 days a year, because dissolved oxygen levels must be high all the time, and must be high in all the water that is in contact with us. Not only drinking water, no, it's not enough. With the water, we clean dishes, we clean clothes, we shower, so we clean the water, the house. So, and that's a problem, because the contamination of that water is magnificent. Now it's in the walls, in the floor, in the clothes. So that is the problem. It's not only the drinking water. That's the difference. And this is this block just is dropped in the water tank, and that's it. It's we need about a 1 block for an average water tank house. Normally it's
Thank you.
Thank you. We have a question from Simone.
Unmute yourself, Simone.
Hi, good evening, everybody. I was just wondering about how the product helps women who have gone through menopause and are having challenges with their weight, especially belly fat. And Sandy, I haven't seen you in a long time, but you look amazing.
Thank you.
sorry, I don't understand clearly, please.
She's wondering how it works with weight loss, especially
Yes,
belly fat.
very well. Because the obesity begins with this. All disease begin with this. Obesity is not magic, of course, but the patients drop weight gentle, and the tissues is not laxed. No, it's all the body retain their capacity, their functions.
So if there's an underlying condition that's causing the overweight, the Qiapi will assist in balancing that condition, and then the weight will drop off. Correct, Doctor?
Yes, yes, because when the body is in balance, and the people has its kidney is weight, increase the weight, and when the people has overweight, then drop. It's the body. That's what. No, it's not the gap. It's not possible. But the balance that induced Qiapi is the answer.
Well, that
Qiapi-
makes sense.
Qiapi seems to be the answer to everything, because whatever is in imbalance will get into balance by using the Qiapi.
What about parasites?
Parasites.
Parasites.
Please write it.
Write it.
I will.
Please.
Simon, what is it in Spanish? Parasitas?
Parasite. Oh, yes. Increase, improve, because the body has good resistance to infectious agent. we are share the war since the beginning of time. So when we are in balance, we are in a good neighborhood.
Good neighborhood, right?
Yes, yes, it's a weight loss. See, after menopause, yes. After menopause and before menopause, no problem. This classification is just artificial. The body don't take care of that. The body has the capacity to make the best results, depending of the condition, but it's the best result.
So, Dr. Arturo, I have a question about the eye drops. I use the eye drops once in the morning and once at night. Is that correct?
Yes, if your problem is moderate, it's okay.
What if I need, so what if my problem isn't resolved? I'm still wearing glasses.
No, okay. The improves is your vision improves with or with glasses, and the graduation of the lenses is normally improves in more or less degree, but the main merit of the treatment is that glaucoma, macular degeneration, and diabetic retinopathy, and many other diseases, but will improves. So if you in 20 years you say me, I feel in the same way, okay, you keep your function. You not complicate. So you see, your health is keeping, is maintained. That is the most important.
Yeah, they've been watching me for glaucoma for many, 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 many years. And my vision has improved slightly, measurably in the doctor's office from these drops. But and as far as and they've already come to the conclusion before this, both the optometrist and the ophthalmologist feel that my situation is just stable. It's been like that. It's not changed. I may have been born that way with the pressure, for the glaucoma. So, yeah.
No, glaucoma always is worse, always. It's the main cause of blindness.
So would you use, if you have a tendency, if you have high pressure, would you use the drops more?
3 times a day.
Okay.
You when you feel good, 2 times.
Okay.
When you have something problem, 3 times, because the body is
Balancing.
And just one drop, or how many drops every application?
with 1 drop. If you make all the surface of the eye, it's enough.
Okay.
If you feel that not humectate well, it's okay, 2 drops.
Got it.
Because
and what if you, I'm sorry.
Because the ETO is complement the balance that induce Qiapi.
Right. Okay.
So and a body, an eye imbalance will drive pressure, intraocular pressure, very well. Has been done million years, has been done million times. What's the problem?
And now, what if you wear contacts? How much time should you wait before you put the contacts in? After you put drops in?
Contact
lenses?
You can put this with contact lens, no problem.
Okay.
Yes, no problem. This drops, yes.
Okay. Oh, you mean you can put them in with them in the eye?
Yes.
Oh, okay. Good to know. Thank you.
Yes.
Okay.
it's a good. Yes, you have some opposite to put it, no problem.
Wonderful. Good to know.
Yes,
Thank you.
yes, yes.
Okay.
Okay, Nissa, did you have a question?
Nisa has dropped off. I don't see her here anymore, but she had a question, and I think Dr. Arturo answered. She was asking, where she can get it. So, Simone, you asked about memory response. Memory response well,
Yes.
yeah. And
Yes, and I suggest Qiapi. I suggest Eto
Ito,
also, because the people with problems of memory frequently has macular problems. Very frequently. So you can treat both disease at the same time.
Interesting.
Yeah, of course. Your memory improve. It's right. Yes,
Access to the brain.
yeah, it's because the memory, the mechanism of memory depends. The mechanism of sleep depends.
Okay.
Yes.
Which means for people that have high anxiety, sleep deprivation, disrupted sleep, or high level of stress, it will basically rebalance itself once you use the products on a regular basis. Now I am using the Qiapi drops, these, right? The oral drops, and I use the eye drops, the OP.
Okay.
As well. So, because
I congratulate you.
So I'm addressing it from both angles because I figure, we are exposed to toxicity, not just through our skin and what we eat and drink, but also through our eyes, right? Anything that is open. So all the toxins can enter that way as well. So I'm flushing them out on a regular basis.
It's exposed to tissue, so
yeah.
The Qiapi sublingual and the Eto in the eyes, I think must be a duty, because if you keep your eyes healthy, it's wonderful. Right. If you keep your mind healthy, it's wonderful. If you keep all is wonderful. And now we have the answer. Just drops and just drops.
Right.
No vitamins, no supplements.
You don't need any vitamins or supplements when you're using the Qiapi on a regular basis.
Yes, because vitamins must be as air gives them. Must be as has been done million times, million years. That cannot perfectionate. Cannot improve. No. If you wish vitamin A, you can take a carrot. If you want vitamin C, an orange, a lemon, and a body imbalance takes of the food what it needs.
Yeah, right. Yes, Pam, it is being recorded. Yes.
Okay. I will write here my email if you wish more information.
Well, can the recording be sent to me so I can let my friend Donna and others see it?
Yes.
Okay, great, Nada. Thank you.
Yeah, I got your email address, so we can send it to you as soon as it's transformed into a shareable thing. So,
Right.
right, YouTube. It will come in as a YouTube thing.
It'll be so important for others to hear this. I would be so happy to pass it on to
Yes.
my clients
Yes.
and let them listen in as well.
Yeah.
Mm-hmm.
Yeah.
Yeah,
Thank
this
you.
is- Well,
Dr. Arturo, I had,
look at my hands.
yeah. Right.
They look so young, Dr. Arturo.
I'm so young.
You're very young.
You're
You are a
probably,
very young man. Yes, you are. Definitely.
you're
look
you're
right.
probably aging backwards. You're not going forward, you're
Yes.
going backwards. Your
Yeah.
ATP,
Why
your
not?
ATP is
Yeah,
elevating, not
ADP.
short.
Yes. Yes.
Why not? Oh, yes, yes. I try to find an idea about my material that release oxygen in the water, but in this computer I have not. I send you to your email
Yes.
so you can see how the bubbles is released
Uh-huh.
in a very natural way, because the travel of the bubbles from the bottom to the surface is so smoothly, like must be in nature. The water plants, it's a problem because the movement has a lot of turbulence, and in the nature need quietly. It's very different. I send you tomorrow to your email so you can see.
Yeah, and I can share it then with the recording so that you can share that as well if you like. Yes.
Okay.
Yes, I think
Thank you.
water gets oxygenated in the process of movement in nature. And I think, I don't know if that's correct, Dr. Arturo, but I got this bottle that spins the water, and the bubbles come up, and go through the water very slowly.
Yes, but it's not.
Not the same.
No, because you mean that the air is introducing in the water.
Possible. I don't. I would imagine.
Okay.
Well, how does nature do it? Doesn't
No.
nature do it by the water flowing down waterfalls and flowing in rivers and flowing in springs?
No, because you mean you are introducing air. And air is 78% nitrogen. And that's the problem.
Okay, so how does nature do it?
Photosynthesis
Photosynthesis.
I see.
must be photosynthesis, like in the eye.
Got it. So it's the type of water. It's the clean water.
Yes, because the high levels of oxygen, dissolved oxygen, tends to improve the quality of water, but it's remarkably is not a little effect. No, it's a great effect. Like in disease in our bodies, we feel better. It's the same in the water. With the water, with the adequate oxygen levels, it's a water of high quality. If you put the water and the block, time, I mean months, depending of the pollution, but eventually the water becomes crystalline, completely crystalline. It's amazing what happened. But it's nature that makes the same process to diminish the toxicity of pollutants, to diminish the toxicity of CO2.
So where in the world is this water? He froze.
Yeah. Yeah. You froze, Dr. Arturo. We cannot hear you. Maybe you will come back. Yeah. This is great information, guys, don't you think?
Yes, yes.
Yeah.
And then there's hydrogen water, you know?
Yeah.
Yeah. Hydrogen, yep.
Yeah.
And
Wow.
ways to deplete the deuterium in the water by partially freezing it. So-
Yep,
Okay.
for sure.
We lost him right now. Maybe
Okay, well, we can stop the recording.
he will probably come back. Let's see if he comes back.
Well, we can start it again.
Okay.
Unless there's something somebody wants to say. We, due to technical difficulties, Dr. Arturo has left the room and may be back. So we will start it again if it starts.
Correct. Yeah. Yeah.
It's been very